Today we're discussing bioidentical hormone replacement therapy with Dr. Holly Thacker, who is the author of the book, The Cleveland Clinic's Guide to Menopause, and also the director of the Cleveland Clinic Center for Specialized Women's Health. Dr. Thacker is going to be answering questions that have come in from the internet from a number of our members on bioidenticals. And first up is Marie from Toronto.
I'm looking at a lot of options for the symptoms I'm experiencing with menopause. Could you tell me what exactly are bioidenticals?
Well, bioidentical menopausal hormone therapy has different meanings to different people. It's used as a non-medical term in the lay community to talk about compounding and mixing up pharmaceutical powders of hormones to different doses. I think the best way for most people to understand bioidenticals is the same chemical structure as what the human ovary makes. And there's 3 hormones that the ovary makes: estrogen, progesterone, and testosterone. And what's important to know is there are prescription regulated, safe, and very effective so-called bioidentical prescription menopausal hormone therapy. So women who want so-called natural or bioidentical same type of hormone replacement for their menopausal symptoms can do this, but they don't necessarily have to turn to unregulated pharmacies that are compounding and mixing up these concoctions.
Dr. Thacker, I'm on bioidenticals right now and I feel great, but I have heard there's some controversy. So if I feel so good, why should I stop?
Well, I believe that women should feel good, that midlife should be the best time of their life. And if you are hormonally deficient in any type of hormone, whether it's thyroid or insulin or estrogen, you're not going to feel well. And these hormones interact with other hormonal systems and throughout the whole body. So it is very important to be balanced and feel well. And I think the reason why so many women have turned to these unregulated compounded mixtures is because a lot of conventional doctors have unfortunately turned their back on women. They got the sound bites 7 years ago from the Women's Health Initiative with those headlines about stop hormones, hormones are bad. And it was really overblown. It was a very scientific study, but it was unscientifically interpreted. It was not a menopausal study. It was a prevention study of much older women, many years past menopause, who had no symptoms. And certainly for that group of women who have no symptoms, giving them hormones, bioidentical, compounded, prescription, synthetic, whatever, is not the right thing to do, because you would not take something for prevention that might have a slight risk. And any hormone given in any way has a potential risk, the biggest risk being the rare risk of blood clot. And that's why we don't use hormones preventatively.
What options do I have if I want this process to be all natural?
Well, the term natural is very interesting. I mean, tornadoes are natural, manure is natural. So natural is a marketing term. If you're a woman who goes into menopause, and menopause is a normal life event, so is childbirth. Well, you can die in childbirth, and just because it's a normal life event doesn't mean we medically don't help people. So if you're stopping your periods and you're in natural menopause and you don't want to take therapy because you're not having symptoms, that's great. I would say check your bone density and make sure your healthcare provider is checking the genital tissue and the vagina in particular, because those are the 2 areas that can get thin with the loss of hormones, especially the bone and the genitourinary tract. If you are having symptoms, then the best therapy and the only FDA-approved therapy is prescription menopausal hormone therapy. And I think you need to get educated as to what the real benefits and risks are, because then maybe you wouldn't be so hesitant to use the therapy.
I'm interested in bioidenticals. Are there any risk involved?
Well, the risk with bioidenticals are at least the same risk with any prescription hormone therapy. And they have the added risk of being unknown and untested, and the prescribing physician not knowing exactly what the person is getting. And the big concern is if you get too much estrogen, it can stimulate the uterus, it can stimulate the breast, it can increase blood clotting. And if you don't get enough estrogen, you don't treat the symptoms, your bones can get thin. And if you don't get enough progesterone, if you have a uterus, you can increase your risk of uterine cancer. So it is important to know what you're getting and get the right amount. And these salivary tests, which are being promoted by a lot of these compounding pharmacists, are completely bogus and a waste of money, and they're not validated. The only hormone that's been validated in terms of salivary testing is cortisol, not estrogen, not progesterone, not testosterone. And I see a lot of women who've wasted their money on these tests, and it's ridiculous. And really, what's in your spit or what's in your blood isn't as important as what is in your body tissues, what's in the bone, what's in the vaginal tissue, what's in the breast, what's in the brain. And there is no easy way of checking hormone concentrations intracellularly. So how we medically figure out what a woman's hormone level is what are her symptoms? What does her bone density look like? And what does her genital exam look like? Because that tells you about the body concentrations of the hormones.
Dr. Thacker, thank you so much. This has been a lot of great information. If you'd like to know more about bioidentical hormone replacement therapy, please go to our website at www.sherwick.com.